Hello and welcome to part 2 of the femur and pelvic girdle anatomy. And in this lecture, we're going to discuss the specific parts of each hip bone. Remember, each hip bone is comprised of 3 separate bones that fuse in our mid-teens: the ilium, the ischium, and the pubis. So we're going to start by talking about the ilium. And notice this diagram. We are looking at the pelvis from the lateral aspect, from the side. So this right here is where the head of the femur would sit. Okay, so we're looking from lateral to medial. All right, so the ilium. Notice the ilium is highlighted in green. Each ilium is composed of a body and an ala. And ala is just another word for wing. The body of the ilium is the more inferior portion near the acetabulum, and it actually includes the superior 2/5 of the acetabulum, as you can see here. Again, remember, all 3 divisions of the hip bone fuse at that acetabulum in about our mid-teens. The ala, or the wing, is the thin and flared superior part of the ilium. And of course, you have an ilium on both sides of the pelvis, right and left. The crest of the ilium is the superior margin of the ala. And just to be clear, the crest extends all the way from the anterior superior iliac spine, or ASIS, all the way back to the posterior superior iliac spine. So this whole thing is iliac crest. Remember, you can use iliac crest to help you position for a KUB. And remember, you can use ASIS to find crest if you need to, because ASIS is such a prominent bone anteriorly, or bump on a bone rather. Also, remember the iliac crest is about the level of L4, L5, and our umbilicus. Below the ASIS is a less prominent projection or bump known as the anterior inferior iliac spine. And posteriorly, you'll see the same thing. There is a smaller projection, more inferior, known as the posterior inferior iliac spine. Okay, so I want you to pause your video here and identify the anatomy marked A through H that we just discussed. You can check your answers on the previous slide or in your textbook. Okay, how did you do on the anatomy review? Good? Okay. Let's talk about the ischium next. So here, the ischium is highlighted in purple. The ischium is the part of the hip bone that lies inferior and posterior to the acetabulum. So remember, this is posterior, this is anterior. Each ischium is further divided into a body and a ramus. So here's body and here's ramus. Notice how the body of the ischium makes up 2/5 of the posterior inferior acetabulum. The lower portion of the body of the ischium points away from the acetabulum and ends in the ischial tuberosity, which is a rounded, roughened area near the junction of the lower body and the ramus. This tuberosity is what you feel when you sit on your butt. So think about if someone says, you have a bony butt, that is because they're feeling your ischial tuberosity. Okay, presuming you were sitting on their lap. That's kind of a weird analogy, but in any case, the ischial tuberosity is what we sit on when we're sitting. Okay. The ischial tuberosities can actually be palpated if your patient is prone or laying on their tummy, and that can help you locate the pubic symphysis. Remember, the ischial tuberosity is about 1.5 to 2 inches below the pubic symphysis joint. But we typically don't palpate the ischial tuberosities because, of course, that could be embarrassing for your patient. The ramus of the ischium is anterior. Okay, kind of pointing anterior from the ischial tuberosity. And the ramus of the ischium articulates with the inferior ramus of the pubis bone, and we'll get to that in a minute. Behind or posterior to the acetabulum is a bony projection called the ischial spine. You can see that here. A small part of the ischial spine is actually visible on an AP pelvis, and we'll look at that closer in lab. But directly above or superior to the ischial spine is a deep notch called the greater sciatic notch. You can see that here. Below the ischial spine is a smaller notch called the lesser sciatic notch. Okay, the third division of the hip bone is the pubis or the pubic bone. And on this diagram, it's highlighted in blue. So here is the pelvis from the anterior. We're looking from the front or anteriorly. Here again is that lateral pelvis diagram where we're looking from the side. And you can tell from the diagram that the pubic bone is further divided into three parts: the body, and then the superior and inferior ramus, or rami for plural. The body of the pubis makes up the anterior inferior 1/5 of the acetabulum, which you can see here. It's anterior and inferior. Okay, the superior ramus extends anteriorly and medially from the body. Okay, so here's the body. The superior ramus comes medial and anterior. And again, we'll look at this with our three-dimensional models in lab. The two superior ramus, so here's a superior ramus and here's a superior ramus, they meet medially to form the pubic symphysis joint. The pubic symphysis joint is an amphiarthroidal joint which allows for limited movement. And think about that. That's important for childbirth. So this is an amphiarthroidal joint. Remember, pubic symphysis should be included on all abdominal radiographs, supine that is, but it's also helpful for approximating the level of the femoral neck and the greater trochanter, which is helpful for hip positioning. So let me point that out. The top of the pubic symphysis is approximately the same level as the femoral head, neck, and greater trochanter. Okay. Next, the inferior ramus, so you can see that here, passes downward and posteriorly from the pubic symphysis. So here is inferior ramus, so it comes down and posterior, and it actually articulates with the ramus of the ischium. So remember, this part was ischium. So the inferior ramus of the pubis meets with the ramus of the ischium. My arrow here is pointing to the ramus of the ischium. Now this line is not easily differentiated on a model, but just know that kind of the more anterior part is pubic bone, the more posterior part is ischium. Okay, the obturator foramen is a large opening formed by the ramus and the body of each ischium and by the pubis. So notice, this part is all ischium, this part is all pubis. And that large opening is called your obturator foramina. The obturator foramen, or foramina, is the largest foramen or hole in the human skeleton. And it's very deceiving. It looks like these are just kind of flat holes, but actually in the body they sit at angles. And we'll look at that again when we're playing with our bones in lab. Okay, so let's identify or recap some of the bony landmarks for positioning of the pelvis. So crest and asis are very helpful when positioning for the pelvis. I often just place the top of my light field right above the crest, and that's a nice easy trick. I don't even have to think about where my crosshairs go. I just put the top of my light above crest. Palpating asis can help us look for rotation in the pelvis by determining whether the distance between the asis and the tabletop is equal on both sides. So think about that. If the tabletop is here, and you're kind of eyeballing or guesstimating the distance from the ASIS to the tabletop, it should be equal on both sides. If the left ASIS is higher than the right ASIS, that means there's some rotation there. Okay, it's just something to think about. Again, the greater trochanter, you've seen here, can be palpated through the soft tissues of the upper thigh, and it's at the same level as the pubic symphysis and the femoral neck. The ischial tuberosities can also be palpated posteriorly, and they lie again about 1.5 to 2 inches below pubic symphysis, which you can see here. Here's pubic symphysis, here's your ischial tuberosities. So use all of these landmarks when you're positioning for the pelvis. You know, we avoid pubic symphysis and ischial tuberosity because it's uncomfortable for our patient, but use the greater trochanter, use the crest, use the ASIS to help you position. Okay, we're going to pause part 2 here. In part 3, we're going to talk about some other characteristics of the pelvis and the pelvic girdle that you need to be familiar with.